Hi, Shelley Lynch doing your exam review for NUR250, your exam 2. You guys all did well on exam 1, and I'm looking forward to seeing how you do here. 50 questions, you'll have 1 hour to do it, 15 minutes to review the questions you got wrong. As always, I will do an item analysis afterwards just to see how you guys did and to evaluate the questions. So just be patient after you finish your exam. But to review your content here today, well, first I'll say that I will allow exam backtracking. We had some issues with some students not being able to select or moving forward without selecting an answer and not being able to select an answer. So I will let you know that going forward, you will have to start working with exams where there is no backtracking. And this is how the NCLEX is. So we're, again, just preparing you for this exam. And it has to start here where, you start to train your body and your brain on how to take these types of exams. So I will, for this exam, allow backtracking, but just to be clear, going forward in your next semester, you will not be allowed backtracking again. All right, so module 4, oxygenation perfusion, I think is about 20% of your exam. Just know like the developmental differences and the changes that happen in the body as we age, the types of oxygen delivery, nursing care around oxygen delivery, instead of spirometer, why we use it, how we use it, how often people use it, the teaching associated with it. I think incentive spirometer is something I teach on a daily basis with any of my surgery patients. Assessment around oxygenation and perfusion, the disease, the patho. Make sure, again, you're going to need to know the lung sounds. How to do education around smoking cessation, or just to know the consequences of smoking. Medications used with like the nebulizers, how to teach somebody about handheld nebulizers, basically like the instructions going around your nebulizers and inhalers. How to teach self-care with like some of your pneumonia patients, your nursing diagnosis around oxygenation and perfusion. I think there's already been some conversation about it in NUR252. What else? Yeah, so I think it's about 10 questions here. The next part is on some fluid, electrolyte, and acid-base balance, urinary elimination. Okay, so sorry to skip around. I just wanted to make sure the next part of the exam I have is on genetics. And I couldn't find it, but it's right here under module 4. So you're going to have a couple questions, actually 2 questions on genetics. So make sure you review your genetics. And then the last part is on medication lecture and administration. There's a lot of questions on this. I guess 10, maybe 15%. And so around medication administration, safety with given TPN, IV issues, goals of electrolyte replacements, difference in body fluids, like the man versus the woman, treatment and diagnosis of alterations in fluid body balance and electrolytes. Fluids, electrolytes, and acid base. So the treatment and diagnosis of those. And focusing back on electrolytes, the signs and symptoms associated with abnormalities with electrolytes. A little review on what organs help to control acid-base balance. Some pitting edema questions. I would review this. A couple people are still struggling with pitting edema. Why it happens, nursing interventions about how to get to help with it, how to assess it, nursing care around fluid intake and outputs. Yes, so very common in the hospital. Do you have to, with anybody within, like our congestive heart failure patients, you're going to be doing daily I's and O's, it's called, intakes and output. You're going to be recording everything they drank, any output they've had, and that way you can kind of see what the total body balance is for the day. Daily weights are very important in the hospital. A lot of detailed questions around fluid and electrolytes. More on medication administration, IV therapy, types of IV therapies, IV lines, how to access how to put in an IV line in general, PICC lines, tunnel catheters. Need to know IV solutions, hypotonic, hypertonic, isotonic. Complications around IV therapy, how to access a vein. That's what I was thinking earlier. Access a vein. And then blood, how to administer, what to look for transfusion reactions. Make sure you're putting on PPE when you're ever doing any of these skills where you're accessing IV lines. And then the last part is on, there's your fluid, electrolyte, acid, base balance chapter. And then the last part's on urinary elimination. And again, it's about 10 questions. Developmental considerations from the child to the older adult, how things change with the urinary elimination as we age, what meds can affect urinary elimination, both in maybe making patients urinate more frequently, things like Lasix. Some medications change the urine color. Just have a generalized knowledge of that. These are things that will happen in practice. Anatomy and physiology, the differences between a man and a woman with their urinary systems. Know the definition of no definitions of types of urinary incontinence, UTI risks in the elderly and the woman, and what teaching strategies or what teaching you would give to both people, like what type of teaching you would give to decrease urinary tract infections. And then incontinence, types of incontinence, I already went over. All right. So I am looking forward to some good conversation. I'm posting your review early, and this will be my last time doing an exam review like this. Again, for your final exam, we will do a face-to-face final exam review in December prior to both your 250 and 242. All right. Let me know if you have questions.